over a course of a week, we had 4 tigers and 3 lions develop mild respiratory signs. They were coughing, some of them were wheezing. After a couple days of that, when Nadia began not eating well, we anesthetized her for the purpose of treating her and taking care of her and doing testing to determine what was wrong. As New York City is in the middle of, this COVID pandemic and we're the epicenter for the US, it was logical to wonder and worry whether she could have been infected too. So she was test positive, and it surprised everyone because that hadn't been documented before. We assume it was one of the people who took care of her. We have not had any employees working around the animals who are sick because, of course, we have strict policies about not having people sick work around the animals for the health and safety of the animals. So there's no one who was sick who worked with them. But with the number of infected people in New York City, it's very easy that someone didn't know they were infected and were shedding, or mildly infected, or went on to get sick later, but nobody associated with the cats has been test positive yet. I think if it was any sort of problem for animals in the world, other people would have seen it months ago, long before it reached us. So I think it's pretty unusual. And certainly all of those involved in this outbreak and diagnosis and testing will be sharing the information with our professional peers. We'll be sharing it with zoos and zoo veterinarians in this country and other countries so that everyone can benefit from what we have learned. And certainly people need to be taking more precautions around cats in the face of a COVID outbreak than otherwise had been thought. But this is really an issue of lions and tigers and other zoo animals. It's not an issue for pet cats. If pet cats were affected, we would have seen many sick cats for months as this outbreak progressed. So I don't think it is likely to be seen other than these kind of unusual